Rosie. Okay, Mom, you're on video now.
Okay.
So, what we're going to do is just a few tests for the knee. So what I'd like you to do is we're going to do active joint range of motion. So you can lay flat down on your back. Take your shoes off. Thank you. And this is the motion that I want you to do. Can you do that motion on your own? Great. Other leg. Great. Any pain with that?
No.
I consider that active range of motion, knee flexion and extension. Now I'm going to measure it. So first, we're going to do passive range of motion. Passive range of motion, flexion. So I'm just going to go like this. Do you have any pain?
No.
Okay. So let me grab my goni, which I actually had out. So I've got the lateral epicondyle, the greater trochanter, and lateral epicondyle. Stabilizing arm is with the lateral midline of the thigh. Moving arm is with the lateral midline of the tibia. And you're going to start at 0 and you want to go up to about 150. So I see that you're at about 140, so that's good. Now I'm going to have you bring your leg all the way out, and we're going to use the towel for knee extension. Can you actually scoot up? I don't want your feet hanging off the table right now. Thank you. And let's bring your foot down. And I would pull your pants up. Okay, and just going to check with my goniometer. I believe it's about 0 degrees. So she's got 0 degrees, so that was passive range of motion. Now I'm going to do a PROM accessory. So we're going to start with the posterior tibial glide. I assessed for comfort between the towel and the block. My patient likes the towel, so I'm going to put the towel right up here underneath the distal tibia. Okay. And I'm going to start out with a posterior glide. Pain?
No.
Okay. So the posterior glide was for knee flexion. Now I'm going to do inferior patellar glide, which is also for knee flexion. So it's going to be like this. Pain? No. Normal quantity, normal end feel. Okay. And there is the anterior tilt of the tibia, which I don't believe we're doing, but it would be like this. So now we're going to do the anterior tibial glide. Pain? No. Okay. And then I'm going to do a superior patellar glide. These are both for knee extension. Oh, I'm going to move the towel back down to the ankle. Okay. And then I'm going to do posterior medial glide of the fibular head. So now I'm just gliding the fibular head because we could have a common peroneal nerve entrapment or a fibular head fracture. Posterior medial glide of fibular head. No pain?
No.
Okay. Now we're going to do a medial glide of the patella. And I forgot why we're doing medial glide of the patella. So it's on my homework to go check why I added that back in, even though it is a joint play. So, medial glide of the patella. Feel okay?
Mm-hmm.
Okay. Now we're going to do posterior glide of the lateral tibial condyle. So, this is the one where you go to the other side of the bed.
No.
Okay. And that would be assessing for lateral rotation of the tibia. I mean internal rotation of the tibia. I have to think about that. Now I'm doing the medial glide of the tibial condyle. Okay. Pain?
Yep.
Okay. So that would be all of the glides. I will take this back from you. So now I'm going to do manual selective tension testing. So let's bring, it's a light resistance strength training. I'm going to have you bring your leg up in this motion. You bring your leg up like that. Hold there, don't let me move you. Good. And then I'm going to have you bring your leg out. I know that there's this pole here, so we'll just go this far. Don't let me move you. Good. Don't let me move you. Good. And let's have you flip over on your belly. Your wedge is here. Thanks. The uncomfortable wedge. Okay. So can you just bring your leg up like this? Over there. Good. And you can come seated at the side of the bed. Sorry for all the position changes. And external rotation. Or let's do knee flexion. Don't let me move you. Good. Don't let me move you. Good. And let's flip your leg out. Don't let me twist you in. Good. And let's twist your foot in. Don't let me twist you out. Good. Okay, so that would be MSTT. Now I'm going to go into MLT. We're going to do the Thomas test where you stand up on the side. Remember we did it a few times today? I'm going to just check to make sure this is getting captured. Okay. So you're going to stand up. You're going to do the one leg up. And then I'm going to have you lay back. Good job. And let's lower your leg down. And I see that your thigh's touching the table. See your knee flexion. You got about 100 plus degrees. So there's no tightness. But if there was, what I would do is I'll just take your leg. I'd extend the knee. And I would lower down. And see if that alleviated the problem. If there was an external rotation, it would be sartorius, and if it was an internal rotation, it would be TFL tightness. You could stand down up. Actually, we're gonna have you go on side lying. So if you can lay down on your side right here. And you could face, oh yeah, that's good. We're gonna do Ober's test. So, going to bring this leg back. I'm going to check to see that she's in a neutral alignment in her lumbar spine, and she is. So I feel comfortable taking her into a little bit of extension and abduction. I'm stabilizing on the iliac crest. Now I'm dropping it down. And I don't see any tightness there. So that would be Ober's test. Now we're going to do straight leg raise for the hamstrings. So you can just lay flat on your back. This is the last length test that we're going to do. So this is actually the hamstring length test because it's a muscle length test. It's called straight leg raise if it's for a nerve. Pain? No. Okay, your knee's starting to bend, so I would take a measurement here of your hamstring length. Great. Now we're ready to do, I think, manual muscle tests. So I'll have you you can roll over on your back. Okay. So bring your leg up like this. Hold right here. Don't let me move you. Okay. And now we're going to do a little bit of internal rotation of the hip. Now this is external rotation of the hip, so I'm biasing the lateral hamstrings. Hold, don't let me move you. Okay. And we're going to put you in a little bit of internal rotation of the hip. Hold, don't let me move you. Okay. So those are hamstring strength tests. And now we're going to do hip flexor tests. So just sit up right here. I still feel like those hamstrings are a little, gotta move up. All right, so this is one where you're gonna take your leg all the way up like this. Hold it here. Don't let me move you. Okay. And now you're just gonna put it up a little bit. And I would assess this bilaterally. I'd give both of those 4s. And now we're gonna do the adductors. So the adductors is our favorite test. It's when you lay down on your side. You put your this leg up into my arms. And I'm gonna have you lift your keep this leg straight, and I'm gonna have you lift it up, up, up. Make this leg meet this leg. Good. And let's have you stay in a neutral alignment. So lift this leg up. Don't let me move you. Okay, I'm gonna give that a 3 minus.
Oh yeah. Out of 10?
5. And now, while you're in that position, I'll have you do the glute med. This one's the one where you bring this leg up and we flip it out. Okay, let me move you. Relax. Gonna turn your leg out, go up and back. Can you hold this spot right here? Hold your leg right there. Don't let me move you. Give that a 3. And now we're going to do glute max. So you can lay down on your belly. You're doing a strength test of all your hip muscles. So I'm going to have you lift your leg up right here. Hold right there. Don't let me move you. Okay, let's do that again. Let's lift your leg up. Hold it there. Hold it there. Don't let me move you. Okay, I'm gonna give that a 3, maybe a 2. And now we're going to do sartorius. So flip over on your back. Sorry, I'll have to reorder the tests a little better, I think. Wow, move it.
Yes.
Okay, lay down on your back. So this time I'm going to have your leg up into some flexion and some external rotation, abduction. Hold right here and don't let me move you. Three. Okay, so now you're going to sit at the side of the bed. So, I'm going to bring your leg out like this. I want you to hold it here. This is a muscle strength test hold and let me move you. Okay. That's external rotators. No, that's internal rotators. Now hold here. This is internal rotators. 3. All these I would do bilaterally. So that's all the strength tests. Now we're going to go ahead and do the special tests. So the first one I want to do is for the ACL. You can just lay flat on your back right here. And I'm going to do stable Lockmans. So, great. I really hope I can be seen. That's for the ACL. And reverse Lockmans for the PCL. I'm going to do the 2 anterior drawer tests. PCL. And ACL. Now I'm going to do the lateral pivot shift test. No pain? Mm-hmm. Okay. Then I'm going to do the posterior sag side. Okay. And I would expose the tibial tubercles to see if I could see a drop. Now I'm going to do some testing for the meniscus. So I've got you here in supine. I'm going to do Steinman's test. Any pain or discomfort? Mm-hmm. Okay. And I'm going to do Noble's test. So a little compression for IT band on the lat femoral condyle, going into flexion and extension. Any pain? No. Okay. I would be doing a LCL and MCL valgus and varus stress. Okay. I guess I could try it this way. No. I will do the I want to do Wilson's test. Okay. Any pain? Mm-hmm. This is for osteochondritis. Okay, let's have you flip over on your belly. Any pain? No. Pain? No. Okay. Negative, and I'll have you stand up. And what I'm going to do is have you stand on one leg like this. And we're going to hold arms like this. And we're going to twist in, twist out, twist in, twist out, twist in, twist out. And now you're going to put a little bend in your knee like this. We're going to twist in, twist out, twist in, twist out, twist in, twist out. Any pain? No. Okay, have a seat. So, just checking for a stutter of the knee in the plica test. I don't see a stutter. So, now I'm just going to do a little patellar testing. and the prone knee bend, and some palpation for tenderness. So what I'm gonna do is have you lay back down. This is patellar compression test. Can you squeeze this muscle right here? Any pain?
No.
Okay. No patellofemoral pain syndrome. Now, patellar tap test, not a lot going on. Patellar brush test, 3 times up on the inside, 2 times down on the outside. No edema. So, what I'm going to do next is I will do palpation for tenderness. So while you're here in supine, just gonna look at the patella, superior pole, middle, inferior pole, and I'm gonna do the patellar tendon and the quad tendon and the tibial tubercle. Just checking for pain. Let me know if I catch anything. The medial and collateral ligaments. Gonna check for the plicas and the fat pads on the outside. I'm gonna do the bursas, suprapatellar, prepatellar, infrapatellar. Okay, check the fibular head. I'd have you roll over on your belly. Oh, and the adductor tubercle. Medial femoral condyle at the pes anserine. Any pain here? If so, I would check if it was a bursa or Sargent. So let's have you flip over on your belly. So just checking the popliteal fossa for a Baker's cyst. Checking the medial hamstring right here and its insertion on the medial tibial condyle. That's all I really need to check back here. So now I'm gonna have you sit up on the side of the bed. Oh, actually, while you're here, we'll do the prone knee bend from neuro so we don't have to change any positions later. Just checking for the femoral nerve. Any pain? Okay. Now I'm going to bring the leg up and in for lateral femoral cutaneous. Any pain?
No.
Okay. Now I'll just have you sit up on the side. So now I'm going to check the medial and lateral joint lines for the medial and lateral meniscus. Okay, no pain. High five. Done with the knee.